people to do, if you want to get yourself oriented on this heart, kind of sit right in front, right behind it, stick your arms out to the side like this, and put your neck right here. And this is going to tell you what these arteries are on your body. So I'm going to take off the arteries here. Now remember, these are now arteries in the heart, and these blue structures are veins. So don't get those confused, because remember, they kind of flip-flop. So what is the name of this structure as the blood's coming up? This is the ascending aorta, this is the aortic arch, and this is the descending aorta. We're looking at these major structures coming off here. So I'm going to put it right here, stick my left arm out here, that's this thing, and here's my right arm coming out here. These two, this is my left subclavian artery, this is my right subclavian artery. Those are right off to the side. Now, these structures right here, if I stick it on my neck, these are my left common carotid artery and my right common carotid artery. So 1, 2, 3, we've named these structures. However, please note, there's a special feature right here where these two come together. They form the brachiocephalic trunk or the brachiocephalic artery, either one. So please note, what's important here anatomically is we can see that the left subclavian artery and the left common carotid artery come directly off of the arch of the aorta. However, the right common carotid and the right subclavian artery do not come directly off the arch of the aorta. They come off of this structure, which is called the brachiocephalic trunk. So most people have that set up. Some people have anomalies where they come off directly, but this is the customary setup. So please note that. Brachiocephalic trunk, or brachiocephalic trunk artery, whatever you want to put. I always put brachiocephalic trunk artery, that way I don't miss anything. Right common carotid, right subclavian, left common carotid, left subclavian artery. Any questions on that? So they're going to actually stick this thing on there. They're going to put this thing on the table and tag these structures, so please know, because Dr. Mitchell can't do that. The next one, I think we already know the pulmonary trunk and the left and right pulmonary arteries. We're going to go to this structure right here. What is the big vessel entering the heart? This is the superior vena cava. This little thing right back here, we just learned that, is the what vein? Azygos vein. And then, here's the superior vena cava. There's two branches right here, very similar to this branch that we talked about right here, because they line up right behind each other. This will be my right brachiocephalic vein. This would be my left brachiocephalic vein. These two drain into the superior vena cava. Again, same thing, put this on my neck, stick my arm out here, and stick my arm out here. This is my left subclavian vein and my right subclavian vein. And these two things coming right up here, these are called not carotids, these are actually your internal jugular veins right here. Don't call them carotid, these are jugulars. And they're actually your internal jugulars. We're going to follow the external jugulars. These are going to actually branch eventually. So these little holes you see right here, you don't have to worry about these things at all. You just want to worry about that hole back here, which is the azygos vein. Any questions, ladies and gentlemen, on the heart there? All right. Let's continue on.